Well, the study was one of our many deliverables that we complete for Manitoba Health, describing these new virtual networks where patients would have access to additional services and providers that could complement the care that their primary care provider could give them. What we learned is that about a third of Manitobans don't actually see a provider very often, so less than once a year, or in fact, about 10% didn't see a physician at all in a year. So for the other two-thirds that are regularly attending a primary care provider, depending on where you are in the city of Winnipeg, 50% of people are leaving the geography of their MyHealth team and going to a different area. Most rural areas, though, a greater proportion of people actually stay in the same MyHealth team geographic area. So it may be easier to coordinate services there than it would be to coordinate services in the city where you may have people needing to go to other places to access that extra care. You might imagine that people with medical complexities are the same people that are using healthcare services a lot. But in fact, those groups were only about 50% in common. Those individuals with social complexities tended to stand a little bit off to the side. There were many more in some areas, fewer in other areas. Although there were individuals that were also high users and also had medical complexities, they also stood aside. One of the things we did learn is that those social complexities drove about 2 extra visits a year to a primary care provider. And over thousands of individuals, this adds up to a lot of care being provided to those people that maybe additional or different services might be best suited for them. And the primary care network or MyHealth team is the ideal way to accomplish that. Having a lot of information about the patients that may be attending those physicians or the Manitobans that live in the area will help them plan what kinds of extra services they need. And so they'll know, okay, for our high users, what types of services are they using? How many people do we have that have particular social complexities? What kind of extra services can we refer them to that'll help address their particular needs? And so I think that that's the most important thing that the MyHealth teams can take from this deliverable, is to use the information to improve the teams that they do create, or to improve the teams that are already in place in some areas.